Okay. That's okay, but kindly bring the report as you have committed to do. Next is Senator David Wakoli Wafula.
Thank you, Honorable Speaker. Question number 014.
It's whether you have a supplementary question to this question.
No.
Okay. Your time is coming. Senator Manzo Daniel.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask, in relation to the question asked by Honorable Muma, and I want to state that I have evidence with the CS because she's a medical doctor on this particular issue. What efforts have you made to educate the public on such people who get seizures? Because the moment somebody gets a seizure, Kenyans tend to run away from them. And in relation to the counties, have you worked with the health promoters or a policy so that health promoters could also teach common Kenyans how to give first aid in case of seizure? And probably you could use this forum to educate the Senate and Kenyans on what should happen should you get a seizure. You see somebody fall down, what is the immediate thing you should do to save that life? Mr. Speaker.
Madam CS.
Thank you very much, Honorable Speaker, honorable members. Yes, indeed, seizures is one of the areas that is facing a lot of challenges for patients with the discrimination and alienation of the same. And so as a ministry, we are really working towards ensuring that patients receive, fast management. Part of it being through advocacy. We are also leveraging on our community health programs to ensure that we have guidelines and curriculums that are easy for them to utilize. Again, for the school health programs to ensure that these epilepsy and seizures are equally able to be managed before they are referred to the facility. So we are having policies. Yes, we have policies, we have guidelines. We are leveraging on community health promoters. We are educating our healthcare workers on the same so that we improve the management and reduce discrimination of the same. Thank you.
Senator Waheti Duarte, Veronica.
Honorable Speaker, my question would fall and my supplementary question would fall action by Senator Enoch Wambua.
Okay.
So I'll not push it now. I'll wait for the that moment.
Next, Senator Olekina Redam.
Thank you, Mr. Speaker. Mr. Speaker, my question is directly related to the responses given by the Cabinet Secretary from the question asked by Senator Muma. Now, Cabinet Secretary, you've indicated that the biggest challenge is the debt owed by county governments, of about 6.2 billion to KEMSA. You've also indicated that SHA, which you know very well, that in the financial year 2020-2025 was allocated a total of 20 billion 798 827 666 shillings, which is up from the initial of 11 billion 899 413 839, which means there was an additional 13 billion allocated to SHA to be able to ensure that they provide this medicine to the people. If we are having problem, and I really would like you to pay attention to my question, if we have problems with drugs being administered in hospitals because county governments are not collecting the drugs, because they have not paid the money to KEMSA, don't you think that it is time as a ministry to develop a system where manufacturers, Because the question you ask is about manufacturers, where drug manufacturers only release the drugs upon payment by SHA, so that these patients, and I speak this because when I was young, I was diagnosed with petit mal epilepsy. So I know the dangers of people who end up having epilepsy. My question is, don't you think that it is time that you develop a robust system that ensure that all manufacturers list their drugs and only draw them down upon being, so that you don't have to incur all this debt? And I'll give you a very good example. It is like a supermarket. If you walk into a supermarket, you'll buy sugar. That supermarket does not own that sugar. That sugar has been placed there by a manufacturer. So the only time that it is released, it is when he's paid. We have SHA, 25 billion. And then you also have counties collecting money from ONSO's revenue to use. This house has passed a law. So can you please tell us how we solve that problem once and for all? It is not right for people who are sick, people who are epileptic, disabled people who are epileptic, to stay without drugs in their hospitals because county governments have not paid KEMSA for the drugs that they are collecting. Please answer that question diligently, and if you have not understood it, ask me again and I'll explain it. Thank you, Mr. Speaker.
Madam CS.
Thank you once again, Honorable Chair and Honorable Member. So indeed, drug availability is really critical for us. We have one of the key challenges that we have faced as a ministry is ensuring that the drugs reach the last mile and ensuring that we have accessibility to essential medicines. And under the UHC, that is the Taifa Care, we are really working tirelessly to ensure that, first of all, we have recapitalization of medicines in KEMSA, and again, that they are reaching the last mile, that is to the facilities up to level 2 and 3 for accessibility by patients. Now, what we have talked about and we are really ensuring that we implement is that SHA will pay, the counties will, SHA will, after the counties have requested, what will happen is SHA directly for medicines before the money is released to counties. That is, when they receive the money from from the claims, part of the areas, apart from ensuring that they are paying the claims, they will ensure that medicines are also withdrawn from that money, and that way before the money is released to the county. So it is an area that we are looking into together with SHA to ensure that we are paying up for the medicines before the rest of the money is released. And that way we want to ensure that KEMSA is routinely recapitalized, it has resources, it has essential medicines to be able to supply at county level. I don't know if I've made sense.
Senator Redamo.
Mr. Speaker, I'm not sure the Secretary understood my question. Because now you are saying that SHA will pay KEMSA before that releases the drugs to the hospital. The question is, and I want to be clear, and I'm happy to come and sit down with you and try to explain better what I mean. The question is, since we are having a problem with counties paying KEMSA for the drugs, don't you think it's about to become a bit creative and develop a system that will ensure that these manufacturers place their drugs there, only release them when they are being prescribed to a patient? That will solve two problems. Problem number one, pending bills. Problem number two, expiry of drugs, such that they don't have to be, they will only spare drugs which can be used. Because every day we are told what manufacturers are doing, including others making drugs to confuse people. That is my question, because what you are now saying is that you will develop a system where SHA is paid money before the KEMSA releases them.
Madam,
that's a bit confusing.
If you sit down, because you are not exchanging with the Honorable Senator, when seated you can benefit from your officers.
Yes.
You can benefit from them.
So, Mr. Speaker, I think I've made it very clear, but now I'll allow my colleagues to maybe piggyback on my question.
Your colleagues, it isn't any senator with a supplementary question. Not you can't give your colleagues that opportunity to do that. But I think she has now understood your issue. No, let her first answer. I want her to convince first Senator Ndama, then you can ask your. And I give you also an opportunity, remember? You ask your supplementary question. Okay. I'll come to your rescue at some point.
Other innovative interventions that we can ensure, and we appreciate Senator for the interventions that you have placed in front of us. So we will have maybe engagements on the side to see how we can extensively improve commodities reaching the last mile. And additionally, we will have a comprehensive report on how we are having our health products to be there at county level and especially at our facility.
So, Honorable Senators, on this issue, I want to guide that on KEMSA issues, I hope you are still the chair for health, isn't it? Or there's some guidance I wanted to give through the committee of this House on Health. Because so what I want to guide is on these KEMSA issues, the Committee on Health of this Senate to follow up with the CS, Senator Ndamolekina, the ministry will be very happy to benefit from innovative ideas that are. So anytime you can approach even the ministry, sit down with the team, and also offer solutions to the country. I'm happy that we are giving solutions, and that is the way to go. Because we always complain and say things are not working. Then how do we make them happen? As leadership, as leaders, I'm happy that now we are giving solutions. So the Senate, through the Committee on Health, should be able to follow up on that report on reforms to do with the KEMS, because that is where the problem is. And Senator, I think you are a member of the Health Committee? Yes, definitely. Now you have that opportunity to really team up the committee, the entire committee, so that you can be able to really discuss these issues and bring the report to this House. But what give the Senator Mandago, what is it that